Welcome to SLP Full Disclosure. I'm your host, Michelle, and today we have a very special guest with us. Not only is she a very dear friend of mine from many years ago, but she is an expert in the field of psychometry. And I know that you're probably thinking, well, we're speech language pathologists. What are we doing talking about psychometry? Why do we have a psychometrist with us? Well, when I first began working with my friend Katie, that I'm going to introduce to you shortly, I very quickly learned that there were a lot of things that I didn't even know that I didn't know. And she kind of helped bring all of this world together for me as we worked together side by side. As the psychometrist, I was the speech pathologist and lead special ed teacher, and we held all of these eligibility meetings. So I would love to introduce to you guys to my friend, Katie Zachary. Katie is a psychometrist in the great state of Alabama. She received her master's in education from the University of South Alabama with a concentration in school psychometry and psychology. She has been working for over 24 years in this field, and she comes to us today with a vast knowledge. And I hope that you guys can learn something from my friend Katie. So, Katie, thank you so much for joining us today.
Well, thank you so much for having me, Michelle, and also thank you for your very kind words. I do not feel like I'm an expert in anything. I feel like I learn something new daily, which is we all do. So, but yeah, I have been doing this quite a while, and I would be happy to answer any questions you may have if I'm able.
Yay! Okay. So, Katie, the reason that I wanted to have you on is because when I started out as a speech language pathologist, as all of the speech paths know who are listening to this podcast, we're extensively trained in language scores, language testing, articulation, and interpreting those test scores. So when I first started having meetings with you back in Alabama, and you were talking, you would come into these meetings and you were so knowledgeable and you explained all of these test scores to the families. Typically, the role of the speech pathologist, you go into these interdisciplinary meetings, you present your speech and language scores, and then I admit that I used to tune out. But what I quickly learned was that the psychometrist, I know, shame on me, right? The psychometrist has a lot of good information. So my first question for you is for you to just tell us, explain what an IQ test is. What is an IQ test, and what information does that individual test give us as speech language pathologists, as an educational team?
An IQ test is a measure of general intelligence, okay, of the factor G. That is applying information in new and different ways. And IQ does not change within the band of error. For example, if your IQ is a 100, the band of error is typically 96 to 104, let's say, okay? So I use the band of error. So with 90% confidence, I can tell you that your IQ will fall in that range every time it's measured, okay?
Okay, you said your IQ doesn't change. At what age do you get the most accurate IQ score? Like once you test that IQ, at what age is that pretty set in stone?
Well, I think that 5. I've never given an IQ test to a 4-year-old. I love a second grader.
I think we all have our favorites, right?
They are the ones that are more engaging, aren't as nervous, all of that. On the flip side, I also tested a kindergartner this year that had a 121 IQ with average being 90 to 109. You could have knocked me off the chair. He was
Wow.
that smart and that much fun.
Okay.
So Any age is a good age.
Okay. So once we test these kiddos 5 to 7, 8, or any child, once we get that IQ score, that's not going to be something that's going to fluctuate or change unless you have obviously some sort of head injury, traumatic injury,
Correct.
or something like that. Okay. So when you're determining what, because I know there are like language testing, there's 100 different tests that we could give to test language skills, right? How do you determine what IQ test to give? And when you're going into these settings, because you work primarily in the school setting, which I think a lot of our listeners, our speech pathologists, are school-based speech pathologists. But even if you're in a nursing home facility, if you're in a hospital setting, IQ, psychometry, all of that's going to be the same. But when you're going in and you're trying to make that determination, what IQ test do I give? And you go into that school, what information do you get from your speech pathologist that helps you make that determination?
Well, the first thing I do is as a good clinician, I've gone through the referral, the reason for referral, all of the background information. It's very smart to know your schools, to know the community that you are living in, their socioeconomics, all of these different things. Then it is very important when you see language concerns and you see fluency problems and you see all these different reasons for a referral. At that point, I would go to the speech language pathologist and she could give me some more insight along with the classroom teacher, along with a wealth of so many people, but the person who is the expert in language is not me, it's you. So
Right.
you are the one that I rely on. I also, you have to keep your ears open in a school to hear what teachers have to say, to the office staff, the custodians. These are the ones that know them more in a social, how they get along with peers. Are they talking to friends? What language are they using? Can you understand them? Can you send them out on their own? So there are many different variables that go into a decision like that.
Okay. But your speech language pathologist is that's a go-to person because they're going to have a lot of information.
Absolutely.
Because like you
They're
said,
going to have,
yeah, you mentioned something, you said fluency. So those students who may be stutterers, those students who have severe articulation disorders that you as a psychometrist are not trained as a trained listener to be able to understand them. So all of those factors play into when you're making that decision, correct?
yes, because if you have a student who is a severe stutterer, like I said, I have been doing this a very long time. So most of the time I can pretty much decipher what they're saying. But if they have a severe stutter or problems, I will automatically do something different because I have to take not the speech part out of it as well.
Right. So, speaking of that speech part, taking that out. So, before we get into what all these numbers mean, I know that one thing that I was not aware of with IQ testing as it relates to language, and something I remember the first time I heard you say it many moons ago. Gosh, how long has it been?
20 something year.
Probably been 20. Yeah, because my daughter's 24, going to be 24 this weekend. So it's been
Yes, so a
20.
16, 18 years ago. Yes.
Yeah, so it's been a long time. I remember the first time I heard you say that, my ears kind of perked up and I was like, oh, wait a minute, what does that mean? So there's something that you do, you can do a nonverbal IQ test. So I think we
Yes.
all are familiar with a traditional IQ test. Explain to us what a nonverbal IQ test is and what it means to take that language piece out.
Okay. Well, a nonverbal IQ is just what it means. It's nonverbal. you can it can be administered to not only students with speech or language problems, but also to students who are not children who are not they're English language learners. So
Okay.
that's another big component that, depending on, once again, you have to know the populations of your areas to know what you need to have with you.
I had
Okay.
never even thought about that the English language learners would also be a good candidate for a nonverbal IQ test. That makes sense. Yeah.
Very much so. That is usually autistic children,
Mm-hmm.
depending on where they are. That I do that a lot, but primarily nowadays, in what I'm seeing in my area, is I'm giving it to a lot of English language learners.
Okay. And what does that look like? A nonverbal IQ. So you're just asking them to do tasks without using words,
Yes,
right?
yes, and some of them, they will have pictures you can point and show them the pictures of what you want them to do, since you verbally cannot tell them what you want them to do.
And are those scores that you get from a traditional IQ and then a nonverbal IQ, are those scores comparable? Are they pretty much the same across the board? For example, and I think my question is, if you were to give a verbal IQ test to a second grader and get a score of 100, if you gave that same second grader a different IQ test but gave them a nonverbal, would you also get a score close to 100?
Yes.
Okay. So it's not going to, so
Yes.
even if a child has good language skills, if you take that language piece out, you're not going to see a big fluctuation in those scores.
Well, it depends,
Okay.
because you could have a very verbally loaded child.
Okay.
Okay. And that is the best single predictor, your verbal IQ. I know we're talking about nonverbal, and I'm going to get to that in just a second.
Okay.
That is the best predictor of achievement, like
Okay.
school achievement.
Okay. We're going to get to achievement scores here in a minute too.
Okay. The nonverbal IQ is considered an indicator of potential to learn language.
Okay. All right. That
So
makes
if
sense.
you have, indeed, language and IQ, as I know we will discuss later, IQ is indeed is affected by the language. So when you take the language portion out, you are getting the best score you can on that day, but
Okay.
you are leaving out many different areas of intelligence.
Right.
But the nonverbal, like I said, is the best indicator of potential to learn language.
The potential to learn language. So that's going to be for our kids, like you said, who are on the autism spectrum, who have limited engagement, who have low cognitive skills, those kinds of things. What is their potential to learn language? Okay. Now, I don't know if it was just me and maybe I just wasn't very smart and maybe I missed that day in class when I was in graduate school. But the main reason I wanted to have you on today was because when I realized that as a speech language pathologist, when I do my language testing, a comprehensive language assessment, and I get an expressive language score, a receptive language score, and then a comprehensive overall language. In all of the years that you and I worked together, Katie, you can agree with me that my language score was usually within 5 to, if it was 10 points, that was a big gap. But that language score was usually right in line with that IQ score. Am I the only speech pathologist that did not know that? Or is that something that you just kind of have to learn on your own like I did?
I think you just learn it as you go along. And Michelle, of course, is an incredible speech pathologist. Like I worked with her for many years, but I've been blessed to work with several really good ones in my job.
Mm-hmm.
And they always come out the same.
Yeah.
And sometimes you have to step back and look. You wait for other different scores to come in if there is a discrepancy between that language and verbal. It is a red flag to me.
Right.
But then you can't, you have to wait, be patient, and see what else is done. And typically it all lines up.
Yeah. And you and I were very lucky. In all the years that we worked together, I think we probably could count on one hand the number of times they didn't line up.
Correct.
But the information that we can get as speech language pathologists from our psychometrists, and just also having a good knowledge of how those tests work together. They're separate, obviously. They give us lots of different information, but how they go along together was fascinating to me. And the main reason I became a speech pathologist is because I'm terrible at math. Like it's just not my strong suit. So when I was learning how to do my language testing and interpret those test scores and looking at the bell curve and talking about standard deviation and the percentage and percent delay and all that stuff, it's a lot of numbers. And I remember sitting early on in my career in those eligibility meetings, and people were just spouting out numbers, this 75, 86, 23, the standard deviation, the mean, and all of that. And I was like, oh my gosh, I became a speech pathologist, so I didn't have to deal with the numbers. But then I had the pleasure of working with you, and it all started to come together. Because you said something a second ago, you said there's a red flag. Okay. So what are some red flags that you look at or that you would notice, or something that would stick out to you when you've got that language score and you know that speech pathologist is good? Here are my scores. Here's my IQ. What is the number one red flag that jumps out to you that you would tell a speech pathologist, hey, you might need to take a second look at this?
Well, I would never do that because I'm not the expert in that field. However, that also, like, there could be a big split between your listening comprehension and oral expression score of 30 points. Okay. Well, I mean, that happens.
Yeah.
Well, when that does happen, your IQ it's not all going to line up. So that explains itself.
Right.
But there are different parts of an intelligence test, a verbal, a nonverbal, a working memory, all these different parts of an IQ test. And if my verbal comprehension is low, if that index is low on the IQ test, and it's probably going to be really close to your total language test.
Mm-hmm.
I'm not just looking at, typically, yes, the full scale and the language are together. Those scores are right there. But then you really have to look at more of, that was a really low part on the IQ test.
Mm-hmm.
That's why this isn't matching up, or that indeed confirms this problem in oral expression.
Right.
It doesn't back up that problem, but it helps to know we don't have to do anything else. We don't have to reinvent the wheel.
Right.
And I know, and I also rely heavily on my educational diagnostician who gives all of our achievement testing. They've been doing all of this for a very long time, and they are very good. And when you look at and there is a listening and an oral expression component to an achievement test. Mm-hmm. Typically, the verbal IQ, your language score, and that oral expression score are going to be within 10 or 15 points of each other.
Sometimes even closer. I mean, you and I
sometimes even closer.
That were within 2 or 3 points of one another. And I think as speech pathologists, what I want the listeners to understand is that you can't just look at your individual language piece, that those other tests, that IQ score and that achievement testing, all of that information is vital as you start to plan for IEP goals, how that student's going to perform in the classroom, and looking at just that whole child. So I'm glad you brought up achievement scores, because I didn't even really understand achievement score or achievement testing, and educational diagnosticians. I think they're probably called different things in different districts, but in Alabama, we called them educational diagnosticians. And explain to us how, if we're looking at, and we know that our IQ and our language scores are going to give us a number, because let's face it, we're all looking for, what is that qualification criteria? For
Correct.
most speech language pathologists, we're looking for that 70. Is it 70 or below? We're looking at backup measures. We're looking at expressive, receptive, total language. We're looking at those numbers. Does it meet that criteria? And if we're getting all of the same information, not same information, we're getting the same numbers, what information does that achievement test give the speech language pathologist? Because I had never really even thought to look through that report, because we get these reports from you guys, and no offense, but they're really, really long, right?
Nobody reads them. We know.
Well, I am urging the speech pathologists that are listening to this, read your psychoeducational report. Read it in detail, because those numbers are not just numbers for criteria. They're numbers that give you so much information. So let's talk a little bit about achievement testing and what that gives us in regard to language, like you were talking about, that listening comprehension component, that verbal component. What information does that give us that's different from a standardized language test and an IQ test?
Achievement is assessing academics, your
Okay.
acquired skills and knowledge,
Okay.
where your IQ is your innate ability.
Okay. That's just your ability to learn.
That's you. This
Okay.
is who you are.
Okay.
Your achievement is, are you getting everything to the potential you're able to learn?
Right.
Okay? So here we got our potential to learn right here. We know what our IQ is.
Right.
And if we have a overall, depending on if you use patterns of strengths or weaknesses, or a severe discrepancy model, or whatever model you might use in your different parts of the country.
Right.
If there's a really big gap in that area of reading or math, then we definitely have a learning disability in that area.
Right. And all of this kind of finally came together for me because of a personal reason. So, Katie, you were with me when I was having my daughter tested, when she was diagnosed with dyslexia, and we went through all of this. And I was able to see that her language was above average. Her IQ was above average. I think you even told me exactly what test to ask for them to give her based on what her, the fact that she was struggling in reading. And then we got that achievement test. And when it was, I guess, and it's sad to say, but when it was personal to me and I had it all there for my child, and we were trying to determine what's the best course of action to help her learn how to be a better reader, then it all made sense, because everything was average to above average in all of those areas. Math was through the roof, which is why she's a math teacher. But then that phonics was it absolutely. And I remember showing you that report, and you were like, well, there's the problem right there.
Right there.
She doesn't know phonics. So we were able to, with all of that information, we were able to pinpoint and narrow down where she was struggling, which then led us on to further dyslexia testing and her diagnosis.
Correct. And then look where she is today, because yes, but there is a whole lot more, like you said, to all of these pieces of the puzzle.
Right. And I think that as speech pathologists, we can sometimes get so hyper focused on just that language piece, just that articulation piece. When it's an articulation only, you're the only one in there doing the assessment. So, but you can get so hyper focused on that language piece that you don't take into consideration what information that IQ is giving you, what information that achievement testing is giving you.
It's important when you are looking at the components of an intelligence test and the components of a language test and the components of the achievement test, you will see strengths and weaknesses without really having to dig deeply.
Right. And that's the way it was for Mia, for sure.
So that is the most important thing with pulling it together.
Yes.
But you have to know what scores you're looking for and what they mean. You do not have to know them to the extent that I do, nor should you.
Right.
But you need to know they have a meaning, and this impacts language, achievement, and impacts the student overall, the IQ.
Right, because our ultimate goal as speech pathologists in the school system is for that child to be successful in the classroom, is for that child to be successful academically. And we have, as speech pathologists, I think it's very important for us to know what IQ test did our psychometrist give. Was it a verbal IQ? Was it a nonverbal IQ? Because that's a pretty big piece of information that you need to know. Because once we have all this information, then we have to sit down, and that's when we start goal planning. So that lets us know and that achievement test, where are the child's strengths and where are their weaknesses, right?
Right. Like, for example, if a student has difficulty with auditory processing.
A big one. We hear that all the time in the speech world.
And they're most likely going to have difficulties in reading math, like reading the word problems, writing, spelling, note taking, poor handwriting, which is a whole nother, but they will have difficulties in that area.
Right. So that IQ test, the achievement test, and the language test, based on those scores, that's how we're going to determine, because we get referrals, this child's not doing well in the classroom. They're failing reading. They're failing math. Their comprehension is poor. And so they do a comprehensive evaluation. And as the speech language pathologist, we're thinking, okay, how are they communicating? And how are they taking that language in? So then we throw in a whole nother set of numbers, which is going to be our behavior scales. And as a speech pathologist, I can tell you certainly that I never even took a second look at those behavior scales. I was like, that's something that the teachers are doing. The parents are filling them out. They're looking at ADD, ADHD. That doesn't really have anything to do with their language, but boy, does it have a lot to do with their language, because it gives us a lot of information as far as not just how they're behaving, but it gives us a lot of information about how are they taking information in, how are they processing it, how are they, because a lot of times they'll tell you, if a child is acting out, it's because they don't understand and they don't have the verbal skills to communicate. So what do the behavior rating scales tell you about a child?
A lot. It tells us, especially if you want to start with attention scales, and there are many, many of them out there.
Right.
So that also helps determine sometimes what IQ test I give.
Right.
If we have if I'm testing a student that has, doesn't have the ability to attend, I'm going to give them something, where I can get them in and out faster.
Right.
Because I know they cannot attend long enough to the task at hand. Right.
Because IQ tests are like language tests. They take a long time. They take a minute to do. And they're very tedious, and they're having to do a lot of different things at the same time. So for those kids who have attention problems, that's going to also impact which IQ test you give.
Yes. And like, for example, there's some tests that have many manipulatives to them, like many,
Mm-hmm.
many of them. I'm not pulling those out with a child with ADA. I mean, that is severe. They're unmedicated. And because my toys are going to end up everywhere.
Right.
So they're not, my bag of tricks is not coming out that day.
Right. Or
I'm keeping them in my bag.
right.
Or
They're going to end
pulling
up in
out
the
something
mouth.
else.
They're going to put them up their nose. They're going to be places they're not supposed to be.
And they're going to somehow, one's going to roll away. I'm never going to know where it is.
Right.
So yes. And these are things I didn't just walk into this knowing these things. This right here is experience. I've been on the floor getting things and doing things and going, gosh, but that is experience.
Right.
So that brings a lot to the table. So I would advise any of your SLPs to talk to their school psychologist, psychometrist, if they have any questions. I'm very open to answering anything, to the best of my ability with anybody who wants to know, because I love testing and I love test scores.
Right.
So generally, if you reach out to somebody and want to know more about this, they will be very receptive to helping explain things to you as well.
Right. And I know in one of I think it was my last podcast, the one that released last, and when I was talking about developing relationships. If you haven't listened to that one, go back and listen to it, because in that episode, I say that one of the first people that I made contact with when I started working virtually was my school psychologist, because of my relationship that I had with you, with Carrie, and all of the other people that I worked with in Alabama, because I know the wealth of knowledge and information. And I know that when we're doing these comprehensive evaluations, and it's so many moving parts. And as the speech pathologist, we're just one small part of that. And we can't get hyper focused on just our language scores, because the IQ, the achievement, and the behavior are going to all give us so much information as we start to goal plan for that child to help them be successful academically and socially.
Yes. And, students who have cognitive deficits, they look at specific rating scales, adaptive scales.
Right.
And yes, I know everybody's looking for a number for a box to get the student the help they need.
Right.
I understand all of that. But there are so many different components of that. The one in particular I'm thinking of, there are like 10 different areas, like community use, health and safety, all these type of things where you can see strengths and weaknesses in that could even help, that would help you with social goals.
Right.
Things like that. So the data is there.
Right.
Some of it, you have to do your own baselines and all those type things. I mean, I know, not that I am not a special education teacher. I am a general ed teacher. So, but I can't, everybody uses all my information to write an IEP, but I legally can't write one.
Right.
So, but I mean, no, I cannot write a speech goal. I'm not even going to attempt to.
Right.
But the information is all there in front of you. Not only is there for the speech language pathologist. Oh, well, we have problems in community use. Why don't we work on, and I'm making this up right now off the top of my head, works on some speech sounds of people in our community, police, whatever sound you're working on.
Right. Health and safety.
Yes, health and safety.
Katie, I think you hit the nail on the head a minute ago when you said the data is there. The information is there. And as speech language pathologists, we can't just look at our language scores. I urge you to reach out to your psychologist, reach out to your psychometrist, read those really long psychoeducational reports, even though they're really long. But don't just look at the numbers. Just like you said, we're all looking for that number to tick a box. And if I can urge the speech pathologist to do anything, it's to take a look at the big picture, because we can't just focus on just that language piece. The IQ, the achievement, and really that behavior gives us a lot of information.
It does. It certainly does. And in those very long psychological reports, it will specifically tell you weaknesses and strengths of the child by
Right.
subtest, which you
Right.
would be able to pull goals from as well,
Right. And
or
I think
set
that
you in the right direction.
right. And that's really important, not just to look at the overall, but look at those subtests, because all of those subtests are they're very specialized. They're very unique, and they all give you something different. And that
Yes, they do.
information can be very helpful as speech pathologists as we're writing those language goals.
Correct.
Katie, it's been awesome.
It has been awesome. Thank you so much. I'll
You're
come back
welcome.
anytime if you invite me.
Yes, it has been so great to see your smiling face. So, when we met for our intro podcast, and we had our little meeting and we talked about what we were going to talk about, you said that you were interested in doing some things with dyslexia research and COVID, how the COVID pandemic impacted our students. So, what do you want to learn about dyslexia? Have you, like, is that where you're going next? Because I know where you are on your numbers, and I know you're about to probably start closing that door. So, what are you going to do next?
Yes, I don't know, but I'm getting very close to ending this chapter of a full time, but not immediately. Trust me, I'll still be around, but I am very interested in dyslexia, just because I love puzzles. I mean, this is why I do what I do, and my life
Right.
is a puzzle. So I'm very interested in learning more about that. We are starting to see evidence coming out from COVID, how it's impacted not only all of us, but specifically the data with students. But some of the things that I'm seeing, you read one thing and it says this, you read another one and it says that. So I think we need more time to really decipher the data and to take more of that information in.
Okay, well, then you and I are going to stay in contact with one another, because as speech language pathologists, I think we all know that the COVID pandemic was hugely impactful for our students that were really early elementary, but even
Yes.
those older kids as well, as far as the language, and it really, that social and emotional piece. Wow. So I'm going to
Yes.
give you some time to get educated on the COVID pandemic and the effects that it's had
Okay.
on our students. And then we're going to have you back on the show another time. That would be great. So
That'd be
thank
wonderful.
you
And
guys.
you're welcome. And what I want everybody to remember, this is a snapshot of somebody on one day when they are tested.
Right.
And this is the information you have.
Right.
So you need to make sure, because we're talking about people's most precious thing, their child.
Right.
And that always needs to be at the forefront when you are explaining scores. I want parents to understand what things mean.
Right. So that's a great point, is, did that child have a good night's sleep? Did they have a good breakfast? Did they get up late and their mom and dad are rushing them out of the door? Did they have a hectic morning? So you're right, it is a snapshot. And I think that that's important for speech pathologists. I think it's important for teachers, for educators, for everyone.
Did they spend the night in a car?
Right.
Anything is possible.
Right. So, well, Katie, thank you so very much for joining us today. It has been wonderful, and thank you for sharing all of your knowledge with us. I hope you enjoyed the podcast today. We will be back soon with some more exciting guests, and we will talk to y'all soon. Bye.
Bye. Thank you.
Thank you for tuning in to SLP Full Disclosure. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and SLP opportunities on our Instagram at AMN Allied. Special thanks to AMN Healthcare for making this show possible. See y'all next time.